Hi, my name is Laura, and I will present a summary of my 2-year pre-doctoral fellowship experience. I came into the fellowship after completing a 1-year internship with ArcGM. On the back of the COVID pandemic, the new focus and personal challenge was welcome. My main aims for the 2 years was to improve my understanding of research design, harness more practical skills, and complete 2 research projects, a systematic review and a survey of UK lung transplant centres. Despite having some clear aims, I was also keen to see what other opportunities and experiences would present themselves through having some protected research time. My research focus has been around frailty in people awaiting a lung transplant. We know that frailty is common in end-stage lung disease and leads to an increased risk of death or being removed from the transplant list. Frail patients are more likely to be readmitted to hospital after a lung transplant. However, there remains a lack of consensus on how to best measure or address frailty in lung transplant candidates. My systematic review evaluating the effectiveness of rehabilitation interventions to modify physical frailty in lung transplant candidates has recently been published. A survey of UK healthcare professionals in lung transplant centres highlighted the lack of use of comprehensive frailty measurement tools and the dearth of transplant centre prehabilitation due to barriers such as space, funding, and the travel distance for patients. The opportunities to learn and progress in my research career have been plentiful, from the Research Design MRes module, booked clinical practice training, and access to a range of online resources in research skills and frailty awareness. These have paved the way to implementing some new skills using a range of software, enhancing my critical appraisal skills, and writing for publication. These foundations have led me to seeking and experiencing new challenges and therefore increasing my confidence. But a key factor in this has been the number of people who have willingly and generously shared their time, knowledge, and connections to enhance my links and network of academics in my field. The team within the ARC, my supervisors, and the international network of transplant clinicians I have been lucky enough to connect with at conferences, and now within our UK Transplant Physio network. A real eye-opening process in this fellowship has been establishing a patient and public engagement group. I submitted a successful bid to New Start Transplant Charity for funding and recruited participants, including patients on the transplant waiting list, previous lung transplant recipients, and their carers. We have had some small group and one-to-one online meetings, and these have been so important in helping me consider my projects and potential future work through a different lens. The key moment for me to date has been hearing from a lung transplant recipient describing their view of prehab being about preparing for a new post-transplant life. My narrow clinical focus has previously viewed prehab as being solely about preparing for surgery and a stay in hospital. The group are now reviewing my plain language summaries and supporting my DCAF application. I have also had discussions with and hope to further collaborate with the UK Organ Donation and Transplant Research Network, the UK Cardiothoracic Transplant Patient Advisory Group, and Action for Pulmonary Fibrosis charity who have offered support with feedback on my potential DCAF project. While the lasting impact on my career cannot be easily documented, there are some key outputs from my fellowship that demonstrate the hard graft that has occurred. My systematic review protocol has been published in BMJ Open. I presented the results of the review at the Chartered Society of Physiotherapy conference, and the manuscript has been accepted for publication in Cardiopulmonary Physical Therapy Journal. I presented our survey results at a transplant rehabilitation symposium in Belgium earlier this year, and am preparing the manuscript for journal submission. I have also completed the NIHR Associate PI scheme through my involvement with an RCT investigating virtual appointments versus actual usual care in lung transplant recipients. This has supported my understanding of the practical elements of research delivery in the NHS. Due to the fellowship, I now have a network of researchers and clinicians keen to collaborate for patient benefit, including becoming co-applicant on a funding bid for a heart transplant prehab study. I now sit on the editorial committee of the Association of Chartered Physios in Respiratory Care, and I'm an AHP research champion at MFT. I've enjoyed working alongside some research interns who've supported some of my projects and have more members of my clinical team submitting conference abstracts. My next steps include a DCAF application in the spring of 2025. I'm hoping to learn more about the lived experience of preparing for a lung transplant, the barriers to prehab for those with frailty, and hopefully co-produce a prehab intervention that is suitable for use in the context of the NHS. I'm really thankful for the opportunities the fellowship has afforded me. It wouldn't have been as productive without the support from my supervision team, my MFT colleagues, my PPI group, and the ARC-GM as a whole. So thank you very much.
Wonderful. Thank you for that, Laura. Amazing achievements again. Just fantastic. Well done on getting some funding from a charity. That's brilliant, and your publications. That's really, really great to see, and really sets you up well for your next kind of stage. Um, have we got any questions from anybody in the audience? Just, no, I think everyone's blown away. Oh, Jess, got a question.
Yeah, I was just wondering how you found it. Obviously, the funding to work with the charity is amazing. So how did you approach them, and what was the way that you went about actually getting that? Because sometimes it's not just the funding, is it? It's also just people's willingness to be involved. So I was wondering I guess how you approached it.
So we're lucky that the New Start transplant charity are sort of embedded within our unit. So I know the lady who runs that charity quite well, and I know some of the board of directors, and sort of offer my time to them quite a bit in terms of support groups and fundraising and things. So we already had quite a good relationship, and they've supported us with funding for equipment and things in the past. So I just had an informal discussion really, and just said, have you ever funded anything like this before? And they said they hadn't, and they just asked that I wrote a bit of a proposal which they took to their board of trustees, and then yeah, they came back, and I just said, this is why I'm going to do it, this is what PPI is, these are the potential benefits. And it was about £700, I think. So I've probably used less than half of that so far, so I've got a little bit more to help me with my decaf application. um, in terms of sort of recruiting people, our transplant coordinators have been fantastic, and they've had some conversations with people on the waiting list in clinic, and they sort of gave me a list of names because I was really keen to try and make sure it was a diverse group. And I don't know everybody on the waiting list because of the way our funding works at the moment. So they were really helpful in pointing out people who'd expressed a bit of an interest. I put some posters up in waiting rooms, and the charity shared it on their social media as well. And then, yeah, I had some people that were interested, and then that's led to more links through the Action for Pulmonary Fibrosis charity. One of the people who lead that was quite keen to support, and then they invited me to speak to their pre-transplant support group. Um, so I've been able to talk to them a little bit about my work, and then it sort of worked both ways. I talked about what I was going to do, and they gave me a bit of feedback, and then they asked me some questions about transplant and preparing for a transplant. So it's quite nice. It's a nice sharing of information. But now the Action for Pulmonary Fibrosis charity, they've got quite a good PPI group in there. They've said that they'll help me with my decaf application and sort of my plain language summaries. So yeah, it's been a really nice, and it's sort of extended out from there really. So initial small pot of money has then led to more links with other places too.
Yeah, it's amazing. It's amazing seeing all the work that you've done, but I really like the fact that you're also not just taking from them for your research, but you're actually able to put back in and give them some information, which is, yeah, it feels more like a two-way exchange. That's really positive, and I guess that kind of probably is why you've managed to build up such a good relationship. It's great. Thanks, Laura.
Thanks for the question, Jess. Yeah, absolutely. A reciprocal kind of collaborations are wonderful. And it sounds like you've made that a real success of your pre-doc. A lot of our pre-docs do build up those relationships, which is really good to see. Can I ask a question about the NIHR Associate PI scheme? Could you just tell us a bit how you found that as a course?
I think it's a fantastic opportunity because as much as this fellowship has taught me about writing proposals and how you design research, it was that I really needed some experience on the practicalities of how that works within the NHS, within a clinic environment, working with the staff on the ground running the trials. So one of our consultants just said, "Oh, Laura, I've seen this. Do you think you'd be interested?" And I thought it was at possibly the worst time because it was incredibly busy, but I thought I can't turn this down. So I joined their trial team, and the only problem that I really had with it was that the trial had already started. So I was
Oh,
joining it after they'd done all the initial implementation, training of staff, and dissemination of what was happening. So that was a bit of a shame. But I still managed to get in there in time to do some sort of consenting and helping patient information. And then I'm still doing some data extraction, some data work for them now. But it has been, yeah, really, really useful to see the
okay.
practical delivery side.
Oh, wonderful. Oh, that's really useful, because there might be others on the call that would be interested in that in the future. Thank you. I can see Chris has his hand up. Chris?
Yeah, I was only going to say, I popped into the chat. Would you like to say anything about the challenges of doing a national survey?
Yeah. Yeah, so getting people to fill in your survey, I suppose, making sure you can actually get it known about by the people, that the target audience that you want to try and complete it, was difficult. So that's what I used transplant coordinators again as sort of the gatekeepers at the transplant centres. But then, you know, challenges, people are very busy, aren't they? And they've got a lot to do with their time. So recruitment wasn't very quick to start with. So then we extended it out to social media a little bit, and that did help. Sent some reminder emails. And then I think the challenge of trying to get as much the rich data that you want from the survey, but at the same time making it short enough that people do complete the whole thing, that was a challenge. And I learned a lot from Chris and my team of supervisors, because it's not something I'd done before. The research design module was helpful as well, gave me a good background about theoretically what I should be trying to do, and then the practical element came. So yeah, it was challenging. Yeah, a steep learning curve.
Brilliant. Thank you. I think resilience and tenacity are two things that you need in academia for sure. Yeah, recruitment can be particularly challenging, so well done on getting there with that, and good luck with the publication. Any more questions before we go on? No? Okay, well, thank you very much, Laura. We're going to go on